The following program is presented by the Metropolitan Library Service Agency.
Hello, welcome to All About Kids, a program focusing on the interests of children and young people and some of the issues affecting them. The topic of today's program is an issue which affects almost every family in Minnesota. What type of child care is best for your child or your family? Today, Dr. Ron Pitzer, Family Life Specialist in Minnesota Extension Service, Rose Allen, Ramsey County Extension Agent, whose specialty is families and communication, and Dianne Corrin, Hennepin County Extension Agent, who specializes in energy and environment, are with us to help parents decide what type of child care is best for their families. These three experts offer some very practical advice based on solid research on how to choose child care most appropriate.
There are more and more mothers going back to work, being employed full-time or part-time outside the home. We are seeing an increased number of single parents who are needing to work to support their families, and there's also an increased number of dual earner parents who are out there. And more, we are finding that they are asking a lot of questions about child care. Today, Ron and Rose and I will address the issue of child care, and we will be talking about the child care from the parent perspective as a consumer. One of the questions that comes up very often from parents who are either seeking child care or who have children in child care is the issue of what is the impact of child care on the family, not only from the parent perspective but from the child perspective.
Yeah, people are concerned about that question, and rightly they are concerned about that question. Parents need to be careful consumers of child care. This is, as far as I'm concerned, one of the most important purchases that they're going to make in their life. Is the purchase of this important service of child care. That to me is a much more important decision than the purchase of a VCR or the purchase of a refrigerator or the purchase of a car, for that matter even the purchase of a house, which is a rather large purchase. But the purchase of the service of child care to me is even a more important one, and one that does need to be taken seriously and that needs to be looked at very carefully. Regarding the question of the impact, it's a very complex matter. So many things go into that. The nature of the relationship between the parent and the child, the parent's particular philosophy of things, the temperament of the particular child, the quality of the care that's provided by the child, and on we could go with that. Now, having said that, let me see if I can make, at least as a starting point, a simplification of all of that. As I read the research on child care, I think the conclusion we would reach generally is that children who are in child care and children who are raised at home are not going to be very greatly different overall in regard to any aspect of their development than, as I say, those in child care or those raised at home, given 4 big ifs. And those 4 ifs are: if the mother is satisfied with the situation. We should broaden that and say if the whole family is satisfied with the situation. It's especially a concern for the mother because employed mothers are the ones who are most burdened by the combination of employment and doing the housekeeping functions and the child care. But if the mother is satisfied. Secondly, if the mother has support from her husband, if there is a husband in the home, and from her children. And that means both psychological or emotional support, that they stand behind this, that they understand the reason for her being away during the day, employed, and that they provide tangible support. A lot of husbands give fairly good psychological support, but when it comes down to the rubber meeting the road and the giving of tangible support, that doesn't happen as much. But that has to occur. there has to be a reasonable sharing of the housekeeping and child care functions. The third if is that there has to be a good relationship between the parents and the child when they are together during the mornings and during the evenings and on the weekends and on holidays. There has to be a good relationship. And the fourth if is if there is good quality child care provided. So given those, if the mother is satisfied with the arrangement, reasonably satisfied most of the time with the arrangement, if she has support from husband and children, if there's a good relationship between the parent and child, mother and child, father and child, when they are together, and if there is good quality child care available, then I don't think we need to be greatly concerned about negative impacts on the children.
Many of the parents are asking, will this have a bad impact or a good impact? And you're saying then that if all of those criteria are met, it should not have any effect versus the child who is in the home for care.
Yeah. As a general statement, if those things exist, we don't see that there is serious negative impact or that there are negative impacts particularly. Looking at it from the other side, is there a positive benefit to children going out to child care? Well, research has shown that children from deprived environments may be better off if they're in child care. If we're talking about folks who are actively involved in the rearing of their children, who are dedicated to that and thoughtful about it, there probably is not any particularly great benefit from their being placed in child care. Although once children get to be along about the age of 3, they do need some social contacts. They need some opportunities for interacting with other children. That doesn't have to be 8 hours a day, 5 days a week, but they do need some contacts if there are no other children involved. So that's the one thing I would say in terms of a positive. But that doesn't come to play very strongly until the child is 2.5 or 3 years old.
2.5 or 3. We're finding that many mothers that have children under that age are going back to work.
Indeed.
And there are many infants in child care.
Right.
What is the impact of child care on an infant?
All right, and that is the most controversial question of the day, and you could ask a number of experts and you would get some different responses. Let me make a few comments about my interpretation of that. This is getting a lot of attention right now. A major reason that it's getting a good deal of attention right now is that a psychologist at Penn State University by the name of Jay Belsky, who has done a lot of research in child care over the years, but more recently has been looking at the impact of infants being in child care, and we're talking about children under the age of 1 year. He's looking at the impacts of that on attachment between parent and child. And he's raising some cautions about it. He's finding that in a third to a half of the families that there is some indication that there may be some difficulties in attachment between parent and children, between mother and child when the child is placed in child care below infancy. Now, again, it's a very complex issue. First of all, remember that he's finding that less than half of the cases is he seeing anything at all. And we can't be exactly sure what he is seeing. The measure that he uses to test this out is a procedure where he looks at where the baby orients and how the baby responds to the mother when there has been a separation. So they'll set up a situation where the mother and child are together and then they separate, and he looks at what happens when the baby rejoins. Some people are suggesting that one of the reasons that that orientation to the mother is not as good as it might be when they rejoin is that if the babies have been in child care all day with high levels of stimulation, that they may simply need a break from that. So if they turn away from the mother at that moment of rejoining, it may not mean that they're not attached to the mother or rejecting the mother, but simply that they need a break from all the stimulation of the day. And that is something to take into consideration in the placement of children in child care, children of any age, but especially infants, is that there is a limit to just how much stimulation they can have. And when you've got lots of kids around, there's a lot of stimulation. So that's one of the cautions about his research. A thing that has happened is people have generalized some of his cautions about child care for infants to any children. And he does not have concern about the impact of child care, particularly, so long as it's good quality care, on children beyond the infant year. That's all his research is showing. So let's at least not generalize that to think that he's making comments about the effect on 2.5-year-old or 3-year-old or 4-year-old children. It's infants that he's concerned about. But there's not full agreement by any means about how seriously we need to take this. Certainly, it says that we should be cautious. And perhaps ideally, if the parents can work out procedures so they do not have to place the child in care during the first few months or the first year of life, it would probably be ideal. If one or the other of the parents could be with that child during that time, that probably would be the ideal arrangement. Notice that I did say one or the other. It does not necessarily have to be the mother. And this whole issue should not be just treated as a problem of, a concern of, a need of, an issue of the mother. Fathers should be actively involved in that enterprise of examining child care needs and of helping to arrange for the child care and of providing nurturing relationships with the children when they're together.
When I've been with mothers who are discussing that bonding and attachment issue, one of the things that is always brought up is, particularly with toddlers or preschoolers, and when they come home and they're reattaching to the mother at the end of the day or the father, and they may call the mother by the name of the babysitter or the child care provider, or the mother may observe when picking up the child that they're calling the child care provider mommy, and there's some real feeling, and it becomes an issue about that mommy substitute concept.
Yeah, and that's a very important thing to consider about child care. If the child care provider has all of the qualifications that we would say are good to look for, that is, a person who is a warm, lovable person who really does have affection for that particular child, not just children generally, but that particular child, who does things with the child, who is actively involved with the child, there is going to be attachment that occurs. That's necessary. I am not persuaded that there's any serious problem with there being what we might call bipolar attachment. I think it's fine for the child to have attachment to the provider during the day when he or she is in that provider's care, and then there must be attachment, of course, between parent and child when they are home together. And I don't think that the attachment with the provider during the day really gets in the way of that attachment with parents occurring. Again, harking back to that if I mentioned before. There has to be relationship. There has to be interaction, active interaction between parent and child when they're together. There has to be active nurturance of that child. There has to be affection. There has to be talking to and handling and cuddling and touching that child. But if that happens between the parent and the child, there can be attachment both places. Sure, that doesn't feel too good if you happen to see your child calling the provider mother, or if the child, for some reason, refers to you as Sue or Jane or whoever it happens to be. But I think we ought to realize that that does not mean there is not affection and attachment of the child to you. And we probably should feel good that the provider is the type that the children can become that attached to.
One of the things you mentioned early on was looking for quality care. It seems to me to be a very big decision. Where do we get started on that?
Well, probably. There are a number of places. You need to find the care, first of all, especially if you've never done this before. Often it's a very scary and intimidating procedure. In the metro area, all of our counties have what's called resource and referral, and you can usually find this by calling your county human services department. Sometimes there's a charge attached to it, a certain amount. Often these are self-supporting systems, but they have a computer listing of licensed caregivers that they will send out. But you need to then go and interview them. Also check your newspaper. There are often child care centers that you see visibly, and you may want to just go knock on the door and see if they have openings, and also word of mouth. Check with other parents that you know that have perhaps used providers and had good experience with them. I want to say a word about licensing. In Minnesota, licensing is required by law for anyone who is taking care of children, particularly greater numbers of children.
Yeah, if they're from more than one family.
If they're from more than one family, you need to have a license to do child care. One of the things that licensing will provide a parent knowledge about is the physical standards of the house or the center. and that there's an inspection and there are some requirements for physical standards. It also provides for in-service training for the provider, because none of us come equipped always knowing how to take care of children. I mean, parents, I think, certainly often seek out information, and child care providers need to have help too, not just for first aid and nutrition, but also for child development issues. And there's a certain number of hours required of licensed providers every year to update their training. One of the important things too that licensing will guarantee for parents are ratio requirements, that providers cannot have more than 10 children in the house. If it's a group family, if it's a family daycare home, if it's a group daycare home, you can have up to 14, and that's with help. And so there are, all of those things are spelled out in licensing, and also the ratio for centers is spelled out as well. There are a number of things that parents can look for. I think that probably as far as types of child care, the most common kind that is the most visible is the child care center. This is where a number of children, anywhere from sometimes 25 or 30 to 150 children, can be put together in a building, usually with different ages, and in a group, a core of teachers and a director. Beyond that, I think probably the next most common one that we might be familiar with is the family child care home, where someone in their home will go through the meeting the licensing requirements and take children in and care for them. There are nannies who come in and live in your house. Relatives provide a tremendous amount of care. I think it's probably 25 or 30% of the care of children is done by another family member, grandparents or an aunt or uncle or a father. And babysitting cooperatives or play groups, if you don't need to have care all the time, this is a very good option for you to perhaps search out in your neighborhood or start yourself, so that you can do some sharing of care. There are nurseries or preschools for children as they go older. Some kids are in self-care, particularly at the school age, where they will come home or be in self-care before school. And probably one of the best kinds of care is parent care, where parents can somehow arrange their work schedule to have the flexibility to be with the kids.
You've given many options, different types of child care, and some of the physical kinds of things, the licensing. How do we identify quality care? Okay,
quality care is something that we hear a lot about, but I don't think that all the time we know what to look for. So the obvious thing is to look at the physical environment. Is it a good environment that's got good safety features, adequate space for active and quiet play, an outdoor play area? Are there latches on the door, and the other kinds of things that you certainly would want to have in your home as you have a young child that can get into trouble with things. Taking a look at the toys that are provided for kids. Are they appropriate for the age? Are they safe toys? Are they in good condition? Are they creative toys? Kinds of toys that the kids won't be bored with playing. And the overall noise level, I think particularly as you're looking at larger group settings, consider that environment. Is it an environment that your child will be happy in for that day? Beyond the environment, I think you need to look at the qualifications of the caregiver. Certainly training and experience are important, but also how do they relate to your child? Is this someone, as you observe, and I think it's very good when you search for child care to take your child with you, at least on a second visit. How do you observe how the caregiver interacts with your child? And then how do you feel about that person, because you have to interact with the caregiver too. Is this someone that you feel comfortable about? Is it someone that you feel that you can share a common philosophy about child caring? There are some basic indicators of high quality care that you find in the research literature. Basically, smaller groupings of children contribute to better quality of care, and fewer children per adult. So kids that are in smaller groups, and then the kids that have more chance to interact with adults because there are fewer kids and more caregivers. The training certainly is important for the caregiver. Good adult-child verbal interaction, and really listen to how caregivers talk to the children in a child care situation. Are they talking above them and over them, or are they really getting down and talking to the kids? Because this has a tremendous amount of impact on the child's self-esteem and development of language and just overall feelings about that provider. And also the stability of the staff. Is the staff, do they hang around?
Right, that's a real important one.
And probably one of the very important things that I would want to remind parents of is that they need to be actively involved in that program. Are there opportunities for that? And then are you as a parent willing to take advantage of those opportunities?
It sounds like it's really a big task to begin searching out the options, do the visiting, the inquiries, checking on the licensing, all those kinds of things. It's a big job.
Yeah, it's a big and very important job, and it's something you don't want to have to go through very often. That's one of the reasons for needing the stability, or some assurance that there's stability. That's even more important for the sake of the child. But yeah, there's a lot that needs to be looked at, and parents do need to take this this seriously. One of the things I think that perhaps distresses me almost more than anything else is to see how nonchalant some parents are about this decision. There was some research in Iowa that showed that about a third of the people who placed their children in family child care had never visited or met or visited the person. The whole thing had been arranged by telephone.
That's
To me,
scary.
that is a very scary thing to have happen. And part of the reason for that, a major reason for that, is that people were reluctant to be intrusive. It felt to them, three things about it. One is that it felt intrusive, that you go into somebody's home, you go into their home and you ask them all these personal questions about themselves. Some of them were uneasy with that. A second that's related to that is it made it seem too businesslike. What they wanted was essentially to have someone like their granny take care of the kids, and when you went through that sort of thing, it seemed so businesslike that it seemed cold and informal to them. And I guess there were a couple of other reasons. But this is a very serious and important decision, and the interaction is necessary, and the providers want that too. For those parents who are concerned about the intrusiveness of this, the providers want that. I don't think I've ever talked to a provider who hasn't said, I really want that opportunity for interaction. I need that. I need to get a feel for myself too of whether this is going to be a good fit between me and this child. So we do
Sounds like
need
there's
to.
a lot to be. It's going to take time. It's going to take a very conscious effort on the part of the parent, and there are some guidelines that they need to follow.
I guess we want to remind people that finding the appropriate child care doesn't end with your responsibility as a parent. That you have to build a partnership, and we really do encourage parents to think about that partnership that they need to build with that child care provider.
Which leads me right into announcing that the 7-county metro area extension home economics agents are addressing the issue of child care from the perspective of the parent in partnership with the provider. And we hope very shortly that we will have some information sheets available that will help guide the parent through the decision-making process in selecting the physical arrangements, the proper provider to meet the values and goals of the family, getting that feel for where the provider is at and how that melds with where the family is at. And so very soon we will hope that we will have some information available to you from the Minnesota Extension Service on parents as partners with the provider. We also want to let the listening audience know that we have available from Minnesota Extension Service a Keep in Touch series, as we have called it, of audio and videotapes addressing many issues and concerns of the family, some of which is looking at balancing work and family, the child from 1 to 2, and going into many other aspects of family life, communication, discipline, effective listening. And those are available in 3 of the libraries in Ramsey County and also in the Hennepin County Library System. So if you are coming to the library and visiting many of the various departments, do check out the Keep in Touch series. There are 18 audio tapes and 17 videotapes that we are finding are of great interest too and have been used extensively already by family members. Some of them can be viewed or listened to individually, some as a couple, as parents, and some of them also involve or can involve the child. So we encourage you to look for that Keep in Touch series in your local public library.
I'd like to thank Dr. Ron Pitzer, Dianne Corrin, and Rose Allen, all of Minnesota Extension, for providing such good practical advice today.
Your public library has material both on choosing child care for adults, but also books designed for children to help ease the anxiety that they might feel going to childcare for the first time. One of these books is Going to Daycare by Fred Rogers. Mr. Rogers writes about what children might experience at childcare when they interact with new friends and are cared for by new adults, and may be separated from their parents for the very first time. He offers reassurance about the new situation so that children can go to childcare knowing what they might expect to find. He writes both about the individual childcare home as well as a childcare center. Mr. Rogers' first experience books, Going to Daycare.
Going to Daycare by Fred Rogers, Mr. Rogers to most of the children in the United States. Reviewed by Juanita Foster, Children's Services Librarian at the Brooklyn Park Library. Thanks for joining us on All About Kids. Please tune in again.
This has been a presentation of Hennepin County Library in conjunction with the Twin Cities Metropolitan Library Service Agency. We thank you for watching, and we hope you visit your public library often.